Well, the first thing I would simply point out that it was 4 years after that budget that we brought in the largest healthcare transfer from the federal government to the provinces in Canadian history, the $41 billion transfer with the 6% inflation indicator attached to it. And we made it very clear that whatever we had to do in the 95 budget, we were doing so that we could protect healthcare, so that we could protect, in fact, the government's transfers. Now, as to the second thing is, when we did the 1995 budget, we set out very clearly where the cuts were going to be, what they were going to be, and what their effect was going to be. Because the way the Canadian people got behind our budget is that we were very open, we were very honest, and very transparent. Now, I look at those numbers, and I have the same reaction that the C.D. Howe has, that the Fraser Institute has, which is to say quite simply, they can't find that money without major cuts. And I can tell you the one area that clearly is in danger, is going to suffering that, is in fact the healthcare budget, because Stephen Harper has said unequivocally that he does not think that the Canada Health Act or that healthcare is a federal responsibility. And so he's going to stick where the federal responsibilities in his mind are. So yes, I don't think, first of all, I don't think that's the way that I don't think you budget and then 2 weeks later have a whole new set of cuts you're going to have to come up with. Very clearly, cuts which you're not prepared to identify, which is why you didn't put them in the budget. And I think you have to look at where they're going to get it. I don't think they can do it, and I think that they should essentially be prepared to own up what is really becoming increasingly evident to everybody. Si vous me permettez, j'aimerais répondre à